Welcome back, everybody. It's time once again for another episode of Health Talks with Dr. Trinh. The one show, maybe the only show that shows you the path to a healthier life. One conversation at a time. And today we're having not just one conversation, but a whole bunch of conversations. We got the Healthy Brain staff here and to talk about the new Healthy Brain Clinic right here in Long Beach. Welcome. Dr. Trinh, introduce your gang for us here.
Yes. So my favorite two people at our new office. Is this our third week?
This is our third.
This is our third week here. This is our second week of seeing patients, but our third week of being here and just opening the doors. And so Ashley and Veronica.
Hello.
I would not exist without them. They're awesome, and we're expanding the team as we speak as well. But yeah, I want you guys to meet the star of the show.
Hi, everybody. My name is Ashley. I'm a coordinator here at Dr. Trin's site at Healthy Brain Clinic, and this is Veronica.
I'm an MA, but I'm also a research assistant now. I do most of the blood work here and data entry.
So you're the vampire that sucks the blood out of everybody here and then measures it. All right, let's start with Dr. Trinh. Give us an explanation. We'll have him talk for a couple minutes and we'll talk to the staff. What the heck is the Healthy Brain Clinic?
Yes, great question. So we know that regionally in Orange County, in Los Angeles, in this area, we know that Alzheimer's is the number 3 cause of death.
Wow.
Behind heart attacks and right behind cancer is Alzheimer's. It's an epidemic, actually, in the area and in the country, this condition called Alzheimer's. It is the one condition in the top 10 diseases, the top 10 killers, where that the rate of death is increasing.
Oh, wow. That's not good. Okay.
Whereas the other conditions, the rate of death is improving because we're getting better in treating heart disease. We're getting better in treating cancers and chemotherapy and radiation and genetic treatments and all that. But when it comes to Alzheimer's, there has been no successful treatment, which is why the rate of death is increasing over the last 10 years, right? It's gone up over 100%, the rate of death of Alzheimer's. So we're here to try to make a dent in that field. And to make a dent in that, it includes doing research, obviously. So we do clinical trials specific for memory loss, dementia, Alzheimer's, and also for people who don't have memory loss but want to do Alzheimer's prevention, right? We have those kind of studies. But not just clinical trials. We know that lifestyle needs to be involved. We know that diet and nutrition and a whole host of lifestyle activities is important. So we're here to educate as well. The Healthy Brain Clinic is not all about research. It's about education. It's about promoting to the community what a healthy lifestyle is like for the brain. So it's about research and about care. You're putting together the caring component, the research component, and that is the Healthy Brain Clinic.
Now, is there a Healthy Brain Clinic anywhere else in Southern California? Is this the first?
Well, we got the domain name.
But,
Does that make it first?
So this is the first for you. Do you envision this being kind of a satellite office or just a prototype for more to come? Or talk about...
There is no other Healthy Brain Clinic that combines both.
Right.
Both the education and lifestyle along with the clinical trials involved. So we are the first that I'm aware of that does this, and but we're not the last. We hope to expand and get this message into the community.
So who do you serve and how do you reach them? You just open your doors and wait for people to wander in, or is there an outreach program? How do people find you? What do they see? Give me some idea of all that.
Yeah, so we serve those who are concerned about their brain health. Those are
Which is
usually
everybody. Everybody's worried about
everybody.
it.
Yeah. They're usually older folks who have concerns with memory loss. We serve those who are concerned with dementia, with Alzheimer's, but with brain health. We serve those who want to keep their brains healthy for prevention as well.
Right.
So we have a wide audience, and to make it simple for them to find us, we're just healthybrainclinic.com.
Okay.
So it's
So
not hard to find us.
so what who we know who comes in, really everybody, but probably as you get older you start worrying about memory loss and other sorts of things. Is this something that they pay for? Is this something out of pocket? Is this something that gets reimbursed? How does all that work?
So we do not charge for any activities that is done here.
What? Say that again. You got a new store, you got people employed, and this is free?
This is free for patients and participants. Absolutely.
I don't even know how to follow up with that. What's free in this world? Nothing's free in this world. I assume this is this is a business, and so therefore they charge for it. And I was just wondering how people, if it's covered by insurance. But you're saying, so what's the cost covered by? Because you're doing clinical trials, you're trying to get people to come in there and you get paid.
So the cost is covered by sponsors of clinical trials.
Okay.
That if we ever and we plan to get health plan contracts, right, for health plans, the cost will be covered through the health plans. We don't intend to charge patients for any activity with that. And if I need to, I'll sell a few more nose rings for my Amazon nose rings.
I
right?
think that's been a big boost for lots of things here. I've got one on right now. Nobody can tell. No.
Yeah, exactly. I'll send you a few.
Nice.
So, yes.
All right. So this is a different business model from a different doctor who doesn't always think about money first here. I'm amazed that you rented a space. Where is the building at? Where is it in Long Beach?
Oh, we're right across from the Long Beach Community Hospital.
Okay.
We can see the hospital from my window. And so we are our address is 1703 Terminal, Termino Avenue in Long Beach. We're in Suite 201, right at the corner suite in the second floor.
Now, I don't know if I want to go to a health clinic that's on Terminal or Termino.
Yeah,
that doesn't
exactly.
suggest a high success rate here. Come in, and we're on Terminal Avenue here in Spanish. All right. Anyway, all right, so you're at this place, and again, so if I walked in the door today, you're open right now. I heard you say, make sure the door is open in case anybody walks in. You've only been doing this for 2 weeks, so I don't know that anybody's going to walk in today here. It takes a while for people to get aware that something new is there and all that. But let's say somebody walked in today. What would you do for them? What would they expect to get?
We will sit down and do a no-cost consultation. What are they concerned about with their memory, their brain? What are their concerns? Do a medical history, an evaluation at no cost, and maybe consider, based on their concerns, what we can help them solve to fill the gap with their brain health. A lot of it will be education on what they're doing in their lifestyle that they can improve on. We can make recommendations that can go back to their primary care physicians to recommend if they need additional blood work and things of that sort. Or if they're interested, they can participate in a clinical trial that addresses their needs.
So is this just kind of a one-time visit then? I would come in and get assessed. You don't treat patients. You wouldn't come back week after week to, I don't know, to measure your cognitive decline or whether you're getting better?
We could certainly do that. If we create some goal settings, right, with activities they can do, and with these goal settings, there are metrics that we want to monitor to help them with accountability and support. And certainly we can certainly welcome them back to see how they're doing with that. So we're definitely open for that. We're a Healthy Brain Clinic, and it takes often more than one visit for that.
All right. So, how did you find these healthy brain experts here? How did you find they look pretty healthy? So far, we haven't heard them talk, so I don't know if their brains are really healthy or if they're just kind of robots.
I'll let
Maybe.
them chat. Yeah.
Yeah.
So I was working at their sister company at Irvine Clinical Research out in the city of Irvine,
Right.
Dr. Lee's site. And I was there for about a year for Alzheimer's research. And that is all purely clinical research for Alzheimer's, dementia,
Right.
some depression as well. However, prior to that, I was working in the psych field of clinical research. So I was, my home base was here in Long Beach, and I was under Dr. Walling's site. So we did schizophrenia, bipolar, PTSD, depression. So I've always been.
Those are my favorite diseases. I love all those diseases. If
Fun.
I'm going to do diseases, that's the one I want to do here. Yeah.
Yeah. So with my experience in coordinating and managing and driving the clinical trial and seeking out participants who qualify for the study, I was asked to join Dr. Trin's group and come out here in Long Beach.
So why Long Beach, Dr. Trin? Why, of all the places, and you're in Orange County, why go across the border to Long Beach?
Simply because the folks who need help the most are folks who live, who are considered more of the minority population, the underserved population.
Right.
And those includes, Hispanics, Blacks, Asians.
Mm-hmm.
That minority population is more represented in Long Beach than in Irvine.
Mm-hmm. And is it a challenge? Maybe this is a tough question, but we've talked about this before in a show, and I think I know the answer. Is it a challenge to get the underserved served? Is it just simply coming into the community? Come and get it. We're here. Or is there a suspicion, a doubt, a language barrier, a reluctance to come forward, an inability because they can't get there because they're working 12 jobs or they don't have transportation? Lots of hurdles to getting the underserved served beyond just showing up.
Absolutely. Well, I'll let our ladies here.
I think
talk about that for 1 second. I got to duck out for 1 second here. I got a plumber working on something here, but just talk about that and how to amongst yourselves. I'll be right back.
Yeah.
Okay. I think a lot of it has to do with like knowledge and education.
Yeah, knowledge and education. Right.
Knowledge and
What do you think, Veronica?
Outreach.
Outreach, like what you do, go and speak to them. I feel like that's very helpful because obviously if there's nothing like what you do, they have no means of knowing.
Yeah, exactly.
And then word of mouth as well if somebody attends to it.
So is it bringing awareness?
Definitely have to bring awareness out of
bringing awareness because the underserved areas are not aware.
Exactly.
Of
same thing in healthcare, not just research.
Same thing in healthcare with that. So bringing awareness is language a barrier?
There can be a language barrier in the underserved community because if they don't speak English, then translator.
Yeah. So language is a barrier. Yes. Absolutely.
We're bilingual, so
yes.
I know Long Beach a little bit. I know there's a large Hispanic and there is an African American community. There's also a large Cambodian community, if I'm not mistaken, in Long Beach. A large, just like in Little Saigon, there's a large Vietnamese community. There's a little, almost like a little Cambodian community. Yeah,
there is a Cambodian and a Hmong population out here. The Hmong folks, the Cambodians. With that.
So do they have the same issues? Which is to say, you talk a lot about diet and lifestyle. My daughter is Hispanic and married to Hispanic, and Hispanic food tends to be heavier food and more fats and more grease and all this other stuff.
More delicious.
More delicious.
More delicious, perhaps, but maybe not quite healthy brain food, as opposed to people are always talking about the Mediterranean diet, fruits and nuts and vegetables from the Mediterranean region, or the Asian diet, which is heavy, I'm told, in fish and other sorts of fish oils and other things like that. So do you see, is there a cultural built-in advantage or disadvantage based on the food you raised around? What do you think?
What do you guys think, Veronica?
Are you ahead of the game because your family in certain countries only eats fish and not red meat? Because that's red meat's hard to raise in Thailand or Vietnam or Cambodia, so they're just not there. It's not built into their diet. Their cuisine isn't built around it. Or are you at a disadvantage because, and I'm assuming by looking at the Healthy Brains, at least one or both of you are Hispanic here. You grow up in a household that has lots of meat and lots of grease and fat and other sorts of things that taste good, but it may not be good for your healthy brain. So are some of us behind just because of the food we're born eating?
I'm going to say yes a little bit.
So the discussion that we were just having prior was, I think our goal in reaching out to the community is bringing awareness, education, and knowledge to the community in regards to having a healthier lifestyle and maintaining that. That goes along with obviously dieting as well. Right. Dr. Trinh has a great program in regards to fasting that we've all kind of jumped on that wagon and started doing, and it's been a really good, healthy habit. But prior to even getting the knowledge or the educational background, we were unaware about all the health benefits of like fasting. So, you know, and then us being both Hispanic women, obviously we want to ensure that the community is comfortable with, you know, our background as well, and bringing them into this office and educating them. And if there is a language barrier, and in this case, we both speak Spanish, you know, that's something that we can definitely communicate to the community, you know, and share our goals and like what we want to do out here in LA County.
Because it seems like Dr. Trin's always beating up on me and the rest of us. I eat our burgers, and I grew up in the Midwest and meat and potatoes and that kind of stuff. And I had to unlearn that habit. I had to unlearn how I ate. I haven't had a steak in years, but most of my relatives, if I go back there, like, come on, let's get you a big steak, and let's do, because that's what I grew up eating. That's what I liked as a kid, and yet that's not healthy. Maybe not just for your brain, but for your whole lifestyle. That's not a. So I had to unlearn that. And California is much more about, you know, lots of different ethnic cuisines, and certainly
America, let alone
America has changed. My wife is an example. She's a vegetarian. She's from the Midwest. Now she's a vegetarian, you know. And I look at my grandkids who aren't growing up in that, even though they're both Hispanic, they're growing up in a much more Southern California based diet. It isn't all heavy Hispanic food. It isn't meat and potatoes like I grew up with. It's much more. It is a lot of more fruits and vegetables. Sometimes I think my grandson, without even being turned into it, is probably going to turn into a vegetarian. He's just not interested in a lot of this heavy stuff that I go, oh, come on. He doesn't like ice cream and cakes and cookies and all the stuff that I grew up in. He just doesn't like it. And I'm like, wow. So I wonder if somehow we don't have to retrain large groups of people, and particularly the ones you're talking about, African Americans, eat a Southern kind of fried food kind of diet. Hispanics eat a diet that's traditionally a lot of lard and fat to make the food taste
beans.
Good, right? And fried stuff and everything here. Whereas Cambodians, I think, grow up because their culture didn't have meat and potatoes around. You know, they're much more. They're not eating all the fattening foods and the greasy foods and stuff. Now, as they become Americans, yes, we all have a certain Western fast food diet that's not good either here. My grandson stood there to my dismay, love McDonald's and fast food and all that kind of stuff. So that's just as bad, I guess. But do we have to unteach whole groups of people how to eat? I'll give you one other one. We had I was just thinking of this. Years ago, we had somebody on one of our other shows who was trying to reimagine a healthier Mexican cuisine. They were trying to take all the traditional dishes and take all the fattening stuff out of it, the aspect, and so they could still make something that tasted like that, or maybe even imagine new dishes. All dishes from Mexico aren't what we think of. They're not all tacos and
it's not. That's an American thing.
Heavy-duty stuff. There's lots of different cuisines, so they're trying to pick and choose and find stuff. Just as years ago, none of you would remember this, but I was a restaurant writer years and years ago for a paper, and we all used to go to fancy French restaurants. French food, when I was growing up, was the premier stuff. but it was heavily based on butter. Everything was cooked in butter, built in butter. And the new cuisine that started here in California, chefs like Alice Waters and other famous chefs, reinvented classic French cuisine, and they call it California cuisine. No butter, very light, a whole different approach to cooking that we now just take for granted. That's if you go to get a fancy restaurant, I don't care where you go, you're going to have something based on that kind of revolution in cooking. Do we need a revolution in cooking, Dr. Trinh?
Yes, we need to let people know of the health benefits of chicken feet.
Oh,
Chicken feet, yeah. The last thing in the world I'm ever going to eat.
Oh, yeah.
we'll try that on Friday.
Yeah, we'll try it soon here. Oh, yes.
But I think, where there's certain built-in barriers, the American diet, the Western diet, and certainly a number of ethnic diets, the ones we all rattled off, they're filled with bad food. And if you're going to get people to...
All the trans fat.
Trans fat, saturated fat.
Yeah. So do we have to do... And is that a popular message? You're going to tell people, okay, you want a healthier brain? Here's one step, might be eat your way to a healthier brain. And people are like, no, I'm not going to do all that. I'm not going to give up that. Just give me a pill. Give me an exercise to do. Give me a mental.
Well, that's also involved, exercise along with like a cleaner diet. And you can start with baby steps. And, let's say, for example, stop using canola oil and replace that with butter, because butter, obviously your body can metabolize it a lot easier and is a lot healthier than canola oil.
No, I didn't know that. I thought canola oil is the holy grail. I thought you got to get rid of butter. Butter's the bad thing, and you got to put some kind of oil in there.
Or
That's old data.
Okay. All right.
Yes.
So part of it is educating a diet, and then what other steps can you recommend? Certainly exercise, walk more. We all know we got to walk more, exercise more. I don't think we get enough exercise. We're talking on Zoom. You're sitting in a chair. I'm sitting in a chair. This is the way we live our life all day long. I'm going to go from one chair conversation to the next here.
So the ideal evaluation in a healthy brain clinic, it's very different than maybe a physical exam where you go in and you list
they probe you and you list everything that you do.
So in a healthy brain clinic, what we do is we do the physical exam for the brain. It's what we do, right? It's a physical exam for the brain.
So do you pull the brain out and look at it and roll it around and check it for different things here?
Yeah. We got folks knocking on our door.
I was going to say, did we drive them off? Am I offending? They just got up and left. I'm like, wow, okay.
Yeah, we have folks at our door, so that's great. So physical exam for the brain is simply listing all the different factors that may contribute to brain health,
right?
That may cause bad brain health as well, right? What are the different health conditions that lead to Alzheimer's and dementia? Right. Diabetes, high blood pressure, obesity, high cholesterol, lack of sleep. And so we have an itemized checklist that we will go through with every patient.
Right.
Is this a problem for you? Is it not a problem for you? Are you doing okay with this? Are you not doing okay with this? Because to optimize brain health, it's got to be very specific to the patient. It's not a one-size-fit-all program. It depends on what your risk factors are, right? One person may have diabetes, but the next person doesn't have diabetes, right? One person has good sleep, the next person don't have good sleep.
Right.
And so to address and optimize brain health, you're looking at what I call precision medicine. Precision medicine means it's got to be precise to you. It's not a blanket treatment with that, because one patient come in with Alzheimer's. If you see one patient with Alzheimer's, you're seeing one patient with Alzheimer's. Yeah, right. Their risk for Alzheimer's is completely different from the next patient who comes in with Alzheimer's. Right, it's precision medicine.
And so you're trying to tailor something for them. You take a look at their diet, you take a look at their lifestyle, take a look at the underlying conditions that they might already have that might contribute to this or might add to this or exacerbate this. And then you do what? You give them a report, you give them a suggestion, you say, see ya, on
You
your
give
way.
them tailored recommendations based on their risk. Because everyone comes in with a different list of risks that contribute to brain health. We know, at least 12 modifiable risk factors, and everyone doesn't have the same modifiable risk factors because their lives are different, their eating habits are different, their exercise habits are different, their sleep patterns are different. So based on their risk factors, everyone is different. So our treatment and our recommendation is tailored to that specific person.
Then did they take this back to their primary care physician, and that physician says, "Where'd you get this? We're not going to do any of that. Let's throw this out."
Yeah, everything is evidence-based, right? And so if you want to reduce your risk for Alzheimer's, it's got to be tailored to your risk. And
well, I'll go down one more rabbit hole that we've explored before here, and that is the acceptance, or maybe the time, to work on long-range plans in today's modern medical system. I only have 5 minutes with my primary care physician to talk about what I'm there for, an issue, to go through because I have an immediate need. I broke something, I'm sick or whatever, or I have an ongoing condition that needs monitoring, check my blood level, check my diabetes, check my cancer or whatever thing. There's something physical there for. It's like a repair shop. I'm in for a purpose. I don't just pull into the repair shop with my car and say, "Hey, let's just chat some more. How should I keep my car going?" They're like, "Well, call us when your car breaks. Call us when it needs a checkup, and we'll perform that action." But beyond that, I only got a few minutes here. So you're asking people to make lifestyle changes, exercise changes, to understand their brain better. Is there time to do this? There is in your clinic, but when you're off in the regular world of medicine, is there time for these long range discussions?
There is no time at the primary care office for these discussions, which is why Alzheimer's is the number 3 cause of death, because there's no time for this discussion. Because we're the Healthy Brain Clinic, we are dedicated to only this discussion, mainly this discussion for the brain, and it's more than 5 minutes.
Yeah, that's what I'm thinking. So I think there's a need for, even if you just educate the consumer, and some of this, I wish my doctor would talk about this. I wish that, and the doctor says, I wish I had the time to talk about this, but I don't. So maybe you need to go somewhere else, like a Healthy Brain Clinic, to educate yourself as to the risks, educate yourself as to possible things you can do to alter it or improve it, to I'm losing memory, whatever, to handle your fears and maybe help you stabilize, to give you some information, to give you some training, to give you some ideas that your doctor probably doesn't have time to discuss with you. That's kind of an amazing thing right there. The healthcare system's always trying to figure out how to be more efficient, to reduce costs, to reduce the number of times they see patients. And Lord knows all the groups like the one you belong to are always trying to come up with more. We'll encourage you to exercise. We'll encourage your mental health. We'll encourage lots of things because we want to reduce. We want to get to you before you come here. We want to cut down the need for service. We're already backed up. We don't need another lineup of people out there. As much as we'd like to make money, we also know that if we don't get to some of this stuff early, it leads to bigger problems. And now we've got bigger bills, and we've got long-term care, and we've got long-term expenses. So we're trying to be, proactive and get to them. And yet the system isn't set up to do that, to talk about diet, to talk about exercise, to talk about healthy brain, to have a discussion more than a couple of minutes. There's a conflict there. And maybe you guys help that conflict. You have a conversation out of the primary care physician's office that is needed and probably nowhere else is happening.
Absolutely. We are here to help the primary care physician.
Yeah.
We're not replacing the primary care physician.
Exactly. Right.
We are integrating a service that is not done currently at the primary care office.
Because I would think maybe I'm overstating this, but there's a potential for primary care physicians to push back. Who are these guys? What are they doing? Who are they to tell my client, my patient, what to do and what to think? Oh my goodness, they're just filling them with crazy ideas, and now I got to answer all these things and everything here. Just take this pill and do that. I can see a certain pushback, or they can look at it the other way and say, thank goodness, I'd love to have these conversations with my patient, but I don't have the time. I don't get compensated for it. I got too many backed up patients. There's too few doctors and too many sick people out there. So maybe this is a way to offload some of that, like telehealth, like nurses that come out to your place and do evaluations and other things. Maybe this is just another way to offload that conversation in another format and hopefully create healthier brains and healthier people.
Absolutely. We already have primary care physicians sending patients over.
See, there you go. There you go. Go talk to Dr. Trinh. I don't have the time to do this. Go talk to him.
Absolutely. By the way, Veronica is an expert vampire.
I can tell that right away. When I said vampire, the fangs came out. I could see that she relishes getting that blood. You give me that blood, yeah, right. Yeah.
I love doing it.
She just loves all that. Well, we haven't talked to Veronica enough here. What brought you to the Healthy Brain Clinic? I heard the story of your partner there. What brought you to the Healthy Brain? You could be doing anything. Come on, you don't need to be sitting at the Healthy Brain Clinic.
Oh, I love working here so far. I'm actually new to research. I've actually only worked in primary care before, but different sections of it. So I've worked in peds, I've done ortho, I've done pulmonology.
I don't know what any of those things are. Those are those are little buzzwords that mean something in the medical community. I don't know what peds are.
I was actually referred here by Lisa, which is our project manager.
Yeah.
She said that I would probably be a really good fit for here. So this is actually my first time in research ever. And it's very interesting.
And what's different about that? Is it more intellectually stimulating? Is it more rewarding because you see people over a longer period of time, not just in and out? I don't know. I'm giving you answers, but what you tell me, give me your answer. What's more interesting about working in research?
It's so different from primary care in every single way. I feel like it's more gratifying because you actually get to see more of the underlying condition like Alzheimer's and how it works and all these researchers as to what they're doing to better that person in different aspects of Alzheimer's.
So rather than just next, the shopping cart approach, who's next? We're now seeing number 6.
Exactly.
And now you
more
get
like a one-on-one.
Yeah. And how do patients react to this? You've had people stumble in already and come here. You got referrals, people coming in the door. Or are we still waiting for people to catch on you're there?
Oh no, we already had how many? Maybe 20 people already come in.
There you go.
A little more.
So you're getting people coming in the door. How do you get them to walk in the door, Dr. Trinh? You got a really cool sign. You're offering free cookies.
A few days ago.
We have a little table outside our office that says free nose piercings.
Free nose piercings.
Yeah. Oh yeah.
They come in for that, and pretty soon we go further up into their brain. We don't just pierce their nose.
For brain health. Actually, today during lunchtime, I'm doing a lunch and learn talk right here in our waiting room.
There you go.
We don't have a large waiting room, so we can, I invited 8 to 10, folks in the community, and so we have, about 8 folks signed up in the community, and we're just going to do weekly educational lunch and learns for the community about brain health, and so this is a service we provide.
Do you have a giant brain outside? Is there a neon brain in the window that tells me this is the brain clinic?
I wish. No. We have a little plaque at our door. We just got it a few days ago.
Has a little brain on it.
Yeah, it's got a little brain on the plaque.
We're still growing.
We got to come up with some. We got to put our brains together and come up with some brainy ideas on how to make this feel. When you walk in, it's like, wow, this is the living brain. When I was none of you will remember this. You're all way too young. But when I was a kid, it was, I don't know why I remember this, but there was a science fiction movie called A Fantastic Voyage. And it's about somebody has something in their brain and they've got to get to it, and so they shrink a little submarine. They miniaturize. They take these scientists, they put them in a submarine, and they shrink it down, and they inject them into the person's body, and they have to swim through the bloodstream and fight the antibodies to get to the brain to zap this thing.
Magic school bus.
Yeah, like the magic school bus.
Yeah, kind of like that.
Version of it.
And so I thought
Yeah.
that was fascinating because as they took you through the submarine, all the body's defenses, of course, see this as an invading thing, and the blood cells, the white cells, all these things are attacking it, and they're fighting their way up to the brain to help this person, do something from the inside, zap something with their little space laser or something here. And I thought, how they're really, in a way, that's kind of what the world's come to. We're sending little nano probes, we're sending little directed things in there to try and find these things and target them. And I think people are fascinated with that journey, that fantastic voyage of through the brain.
Yeah.
Absolutely. It's so it's good. This is our third week. We're getting the message out. Folks are learning about it at my lectures, obviously.
So how do they, is there give us a site? Can they sign up for future events? Can they sign up for newsletters? Can they sign up for email blasts? I don't know, whatever.
Yeah, they can just go to our website, thehealthybrainclinic.com, or they can go to healthtalksoc.com, which is where this program's on.
Right.
I'm linking everything together anyway onto our website, and folks can find us. We have a phone number; they can call us.
Yep.
And
again, it's totally free, so I can just walk in the door. Do you take walk-ins, or do I have to have a scheduled appointment?
We take walk-ins. We take walk-ins. I'll have to invite you to our next lunch and learn at our office, so you can come check it out, Paul.
So people come, they can get a free evaluation, they can get some tangible ideas of where they're at.
Yes.
And last question is: everybody who's worried about the brain, is it too late for them? By the time you start worrying about your brain is when you start losing functionality. Should we be reaching the two young women?
Late. Never too late to start a healthy brain lifestyle at any age.
Okay.
At any age.
Because sometimes you think, well, it's too late. I already did the damage. And I'm wondering, how do you get young people? I'll ask your two young assistants here. How do I get you interested? You're not worried about your brain at 80 or 70. You're living your life today. You got more immediate problems. The healthy brain, my brain's going to be healthy forever. And then suddenly at my age, you start going, oh, I can't remember something. I wonder what's happening.
Oh, well, I think
See, I got a little sympathy today here. Okay, all right.
I think our age group, we're so stuck on social media. So in that case, you kind of present that knowledge and education via TikTok, Instagram, Facebook, and reach out to the community that way, in order to have the population our age be aware of that and kind of start changing their lifestyle with like dieting, exercise, or even, smaller things such as like not looking at your phone starting, for like 30 minutes at a certain hour a day,
What?
small things, small changes.
Not looking at my phone. It's near me. I carry it everywhere. I sleep with it. I can't let go of it.
Yeah. So, and then again, our goal here is to reach out to this community. Not that Long Beach is underserved, but it is underserved compared to Orange County and Irvine. So just like UC Irvine has been like one of the well-known universities in Southern California to help bring in minority students to get a better education. And
I'm wearing their hat today here. Our studio is there. Yeah, right.
Exactly. So, that's our goal. And we're hoping that maybe, with what we're trying to do, we can bring in the community in the surrounding areas to come in and seek the help that they need if that's something that they're interested in.
Okay.
And again, no credit card, no insurance information is required, nothing
That's
at
crazy. You just
all.
you walk in and help. I don't know about that model. That's a crazy business model, Dr. Trinh. You walked away.
Yep. Yeah. So that's our goal, and we're hoping to be successful at it and educated.
Are there any clinical trials going on now? Are there any starting soon?
Yeah, so we actually have 4 projects that we are signed up for, or that these pharmaceutical companies had chosen us to start performing. At this moment, we are still doing a lot of the study startup, document. It's a whole process. But at this current moment, we are taking in patients between the ages of 65 and 80 to do a blood test to see if they have a certain protein that's involved with brain plaque. And Dr. Trinh is very educated with that, but that's involved in the progression of Alzheimer's. So if we can test to see if you have that protein, we can start with a program that can slow the progression of Alzheimer's.
Is that the amyloid plaque or something?
It is.
He's talked
Yes.
about this before. It's the little thing that builds up, that keeps the synapses from firing and connecting here. It's like a little, imagine putting a,
Yes.
you know, something in between the little electrical circuit.
Yeah.
Here.
Just kind of like plaque on your teeth, it's the same thing in a sense.
Yeah, exactly. Or plaque in your heart that shrinks your artery and makes it harder for the blood.
So that is the study that we're currently conducting at this moment. We do have other studies that will be starting up in February. So and obviously those studies have different criteria for, a patient or anyone who's interested to join. So
we've done shows, not enough, about clinical trials. I think clinical trials are a mystery for most people.
Absolutely.
And here are the three mysteries that people have. Am I going to be taking a placebo? I really need something right now. I'm desperate. But they're going to give me the placebo and give somebody else the actual stuff. And therefore, I'm not going to get well. I want to be on. I don't want the placebo side. I want to be on the test side. That's one misconception, and I think does that happen? You're not doing that. You're not giving people a placebo and other things here. You're trying to do what?
We actually don't have that information, so we don't know who's going to receive placebo or the active drug.
Right. So you're just giving everybody something.
We are blinded. The pharmaceutical company will not give us that information.
All right. So that's one worry. And then the other worry is this is dangerous. It's painful. It's something. It's untested. I don't know. Figure it out on somebody else, not on me. Is there a danger in doing this? Is it?
Absolutely not. So a patient's health is our number one priority. So that's why we are constantly doing blood draws, checking on you. And in case of the event that they are experiencing a severe adverse event, then we take action and pay for all costs that's involved with the study drug if you do obtain it. So nothing will come out of the patient's pocket in case they're hospitalized or have to be inpatient. We pay for everything 100%.
Okay.
So again, we're always monitoring our patients if they are taking treatment in a clinical trial at our site. That is always going to be our number one priority. So we take that very seriously.
And then how long and how much do you get reimbursed for any of this, or just reimbursed for the travel back and forth, or do they pay you? Some of these are paid studies. Does any of that play into it here?
Yeah, absolutely. All patients are compensated for their participation in time if they participate in a clinical trial at our site. Again, nothing comes out of their pocket. They're also compensated for all the activities that are involved. If we need to bring them in for a separate visit that's not in regards to the study that they're doing, they're also going to be compensated for that as well. It just depends on the actual protocol and the study that they're involved in.
So, and then time, does this take years? Is it my commitment? Is it months? Is it days? What kind of time do I have to commit to?
It all varies. We have studies that are 6 months long, and we have studies that are up to 3 years long. It all just varies, and we share all that information with our patients if that's something that they're interested in doing. And we always encourage it because, again, this is not something that we're not trying to test patients. I don't want the misconception of like them being considered as a guinea pig in clinical trials, because that's not the case. The case here is to slow the progression of Alzheimer's and to come up with a medication that's going to aid for the community. So that way everyone has access to it.
Give us again a date on the latest and greatest medication. You had them on the show. There's some very expensive drug that was approved over the objections of the FDA or whatever, the panel, and then they went ahead and approved it anyway, and it's very expensive, and it only applies to a certain tiny percentage of people. And then I just read something else came out here. Just give us the latest and greatest. After 20 years of nothing, it seems like one or more things have suddenly emerged.
Absolutely. After 20 years of nothing, last year we had aducanumab that was approved, very controversial, FDA approved despite the unanimous decision of their committee to not approve it.
Right.
The FDA kind of ignored that and approved it anyway. That medication unfortunately never really took off because of that controversy. But several weeks ago, on January 6th, lecanemab was approved. Lecanemab is an Eisai Biogen partnership, and that data is pretty solid, of lecanemab. And when we have more time, we'll do a deeper dive on lecanemab.
Yeah, let's do that, because I just saw that came out, and I wondered if it was different than or a revision of the previous drug that was
It's not the same drug. Not the same drug. Anyway, our next patient is waiting for us.
Gotta go.
So we are
out of time.
Well, thank you so much, Pa.
Thank you so much. Give us the name and address one last time, and we'll sign off.
Healthy Brain Clinic, address 1703 Terminal,
TERMINO
Avenue, Suite 201, Long Beach.
And the website to sign up or learn more is
healthybrainclinic.com.
Well, we'll leave it there. You look at some healthy looking people who have a healthy interest in this subject, a healthy need for it. I can only imagine this is going to be a healthy and growing enterprise. So I look forward to hearing more about it.
Take care.
All right.
Thank you.
Bye, Paul.
Bye, Paul.
Well, there you have it. One more reason to tune in to Health Talks with Dr. Trinh, to hear about all the things happening, including the new Healthy Brain Clinic right here in Long Beach, right here in Orange County's only community radio station, octalkradio.net, streaming live from our studios here at the University of California, Irvine's Beale Applied Innovation Center.